Hello there, it's me Tina Thomas, and with me I have Richa, and we are from IILT. The next role play that we are going to do is about a patient who is 45 years old. He's a professor.
Yes.
And he's having a small hormonal problem, and he's having acromegaly.
Yes.
Yes. And in this, the patient is a known patient where we are going to open it out to him. We are going to break the ice and tell him that, see, you are having acromegaly.
Yes.
So the nurse has a lot of stuff to tell to the patient, like, you can suddenly telling to a patient you have acromegaly, it's very difficult, right?
So here we have to actually emotionally support the patient, and we have to convince him this is not the end of life, and more details we'll get in the role play.
Yes.
So she will do the part of the nurse and I'll do the part of the patient.
Okay.
So you'll have 3 minutes time to prepare it. Meanwhile, if you have any queries, you can ask me.
Yes, the role play card suggests that the patient is a known case, and how can I address you during the role play?
You can call him Mr. Michael.
Michael, okay.
Alright, so the preparation time is over. Now we'll get into the role play, so you can start speaking.
Good afternoon, Mr. Michael.
Good afternoon.
How are you doing today?
Well, I'm not having a really good time because, as you already know, that I did my blood test a couple of days ago, and I'm here to collect the result, and I am worried what it might be.
Yes, Mr. Michael, I do have your blood result, and I'm really sorry to say that you have a condition called as acromegaly. That is what is being said from the blood report. Do you know what acromegaly is?
I'm hearing it for the very first time. Could you enlighten me what exactly it is?
Definitely, I will tell you. See, the doctor told that you are going to undergo a hormonal test, right? So, in our brain, there is a gland called as pituitary gland, okay? And this gland secretes a hormone called as growth hormone.
Alright.
So, that is the hormone which helps us to know whether we are tall or short, like that, okay? So, in your body, that hormone is more than the normal limit. So that is what is called as acromegaly.
Oh, I'm actually starting to really get worried about it. Is it something like cancerous, or will I die from it?
Oh, don't worry about that. It is common for everybody to feel like that, Mr. Michael. This is not going to be any cancerous. It's not going to spread in your body. It is just a small tumor. With surgery and with other treatments, definitely there's a cure for it, and you're not going to die on that, okay? Yes?
Alright.
There are some signs and symptoms with the person who has acromegaly. May I tell you those signs and symptoms?
Yeah, I experienced a couple of symptoms right now, but I'm really worried about what you're going to say, because will it intensify from the symptoms I experience right now?
Okay.
So could you tell me more details about the severity of the symptoms that I might experience?
Okay, so I will tell you. So the first symptom that you may experience is deformity. That is physical deformity, maybe in growth. Maybe you'll be a little more taller than the normal people. Yes. And then you will have abnormally large tongue. Then you will face erectile dysfunction, and then you will have a protruded jaw. Then you will have large feet, and your face can be, that is, your jaw lines can be a little bit big. So sometimes your face seems to be a little more bigger, okay? And then you will have long fingers and long hands. So these are some of the small physical, not small, like physical deformities that you can have.
I'm really emotionally drained at the moment, because I'm a professor and I have to meet a lot of people every day. I take classes, and that's how I make my living too. So with these deformities, I cannot live like a normal person. People will be looking at me, they might even make fun of me, or I won't be having a social life. So I am actually emotionally so worried at the moment, and it feels like I have come to the end of my life. So you don't have any can I come back from it? Can I reverse my condition? Is there anything I can do to get back to normal lifestyle?
Yes, there is a lot of things what we can do about it, because there are a lot of prompt treatments, so that we don't need to avoid any seriousness of this illness. And as you told me, you are a professor, you don't need to worry much, because this acromegaly is mostly seen in small children. So they are the ones who, shows these type of problems. But as you are now at this age, so signs and symptoms might be less severe, so that you will not have to have these type, you don't need to have that fear of you will feel having these type of problems, okay? So there is some treatment. What we can do is, one is that hormonal therapy. So with this hormonal therapy, your hormones can be reduced. Then there are some surgeries and radiation therapy, so that these hormones can be reduced. How does that sound?
Yeah, but still, I'm actually in a very difficult situation right now. I'm having a very rough time.
I know.
I actually stay alone. I don't have anyone to, support me emotionally, or give me advice about what I should be doing. So as you mentioned that I can consider radiation therapy or even a surgery, to what extent it will be effective, or will I still have the symptoms left?
The thing is, Mr. Michael, you will not have much of it, because as this treatment, I told you, if you need to, it can go to a serious illness, but if you have this treatment done, you can at least have 95% cure from this. Okay, we cannot guarantee 100%, but 95%. With surgery as well as radiation therapy, it's very good. And better than that, I know you are going through a lot of mental dilemma now, and I know I know what you're going through, and I really sense what you are feeling now. So what I could do is I can involve you in some of the support groups where you can talk to people who have had the same situation, so that you will know how to overcome from the situation. Won't that be fine?
Yeah.
Okay.
Well, I hope that would be something I can try.
Okay, and then I will advise you to see a doctor over here. So I've already informed your situation to the doctor, and he's waiting to see you. Would you like to see him?
Yes, please.
Yes, and then I'm going to give you a leaflet on about acromegaly, so that you will have a better idea about it and how to go forward with it. Yes?
Yep, sure.
Yes, and if you need anything down the lane, please do come and visit me, and I'll be there to help you out.
Sure, thank you very much.
Yes, is there anything else that you would
That's
like to
all.
know?
Nothing
Okay
else.
then,
Yep.
thank you, and you take care.
All right, so that's 5 minutes, and that's end of our discussion.
Okay,
Alright.
very difficult situation.
Exactly. So the most difficult thing I feel while we do the role play is to emotionally support the patient,
True.
especially when we are giving diagnosis and the patient is feeling very weak. They feel like their life has come to an end and there is nothing else they can do, and they're feeling very hopeless.
True.
So as a nurse, it would be very difficult to emotionally support someone through words.
Words, yes.
Maybe we can show that by gestures. If the person is close to us, we can maybe hug them or sit with them and talk to them.
Yeah.
But when it is a stranger, it is very difficult to convince them.
And that too, we have our own limitations. Like
Exactly.
actually, we are all from a medical background. We cannot simply go and touch a patient. Because it's
Exactly.
only through words what we can do. Like as you said, if it is a nearby friend or
Yeah.
some of a relative, yes, we can do something like that. But here is something where empathy works.
Exactly.
Yes, right.
And it's not just the words that you're saying, it's the delivery. So
Yes.
we need to really work on the voice modulation. So we cannot just say some words like, I'm sorry to hear that. When you say that, it should sound like, oh, I'm really
You should
sorry
feel.
to
You
hear
should
that.
feel it from a heart and
Yes,
say
the person
yes.
who is hearing you should get the idea, yes, this person really means what the person is saying. So I hope Tina really did a good job to convince me emotionally here. So we will get into how we can do it in a
Yes.
different way, and as to see how good
Yes.
sentences we can create in this work.
Especially when it
So-
comes to empathy formation, because that's
Exactly.
very, very important.
We need a lot of reassurance and
Yes.
acknowledgement statements in cases like this.
Yes.
So we will come again with case notes like this, and we will do the role plays for you guys. So keep watching and supporting us, and we will see the feedback form.
Okay, bye-bye.
Hi, so we just watched a video with a very interesting topic, which is acromegaly. So we saw how Tina Miss tried to convince the patient here. So we know that acromegaly is a physical deformity, hormonal imbalance condition. So the patient is emotionally down, and she was trying to bring hope in the patient's life. So this is a very difficult task, because when it comes to emotions, we find it very difficult to talk to the patient. And as we discussed earlier, when it comes to strangers and emotions, it would be a very difficult time to actually convince them or relate to them. So let's see how we can pick the keywords and create sentences. Let's get started. The first task: greet the patient, check how he has been feeling lately. So the keywords would be greet, feeling lately. So you can start by introducing yourself, you can welcome them, and you can ask him how he has been feeling lately. So the sentence will go like, good morning, Mr. David, nice to see you again. How are you feeling? Simple. So I said nice to see you again is because in the description here it is mentioned the patient has come here before to do the blood test. So this is a known case. So this is how we can do this task. Second one. Empathetically inform the patient about his test result. This is a very tricky task because no additional information is given about how to empathetically tell him. But when you're giving a diagnosis, you have to make sure that the emotions of the patient has been given a lot of importance. So the keyword is empathetically test result. So this totally depends upon how emotionally you can talk. So it also varies from person to person. The way I show empathy will not be the way you show it. So you can use a lot of empathetical statements, or you can use a good voice modulation to connect with the patient here. So if I say a sentence, it will go like, I have your test result here with me, but before I let you know what it is, I would like you to set your mind at ease because we found some deformities in your result. You are having a condition called acromegaly. So this is how I would go with it. So it totally depends upon how you show the empathy, because we cannot have a basic script to how to show empathy. It totally depends on how you as a person understood the patient's emotions and relate to it. So the next one. When asked, explain what is acromegaly, pituitary gland produces too much growth hormone. So what are the keywords? Explain acromegaly. That's the keyword here. So you can say, I understand this comes as a shock to you, but don't worry, I'll explain everything in detail. So acromegaly is a condition where your pituitary gland produces too much growth hormone, more than the required amount. Simple statement. And if you need to provide more information to the patient and make it a little more simplified, you can explain like how Tina showed in the role play. The next task. Explain that it is caused by a non-cancerous tumor. So here the main keyword is non-cancerous tumor, because when you tell patients about a case or a diagnosis, they will be always worried about whether it is a life-threatening one, or will they die from it, or will it be complicated. So here the patient is worried whether it is a cancerous one. So it is very important that you stress on the parameter that is not it is a non-cancerous one. So here you have to say, I know it comes as a shock to you, but I assure you that this is a non-cancerous tumor. That is the next one. The fifth task, inform the patient about the possible symptoms: physical deformity, abnormally large tongue, erectile dysfunction, protruding jaw, large feet, face, hands, etc. So here all the information in the bracket has to be covered. The main keyword would be possible symptoms. So when you're talking about symptoms and when you're telling a patient that he's going to have deformities in his life and he's going to have a lot of difficulties or symptoms like which is mentioned here, make sure that your voice is really soft and your emotional support is high. So let's look into the sentence. You can say, Mr. David, now I would like to talk about the possible symptoms you might experience. You might have difficulties with physical deformity, like abnormally large tongue, and you might face erectile dysfunction and protruding jaw, large feet, face, hands are some of the symptoms of acromegaly. I know this is very difficult for you to take in, but don't worry, with proper management, we can control the intensity of the symptoms. That is the task number 5. Now let's look into task number 6. Empathize with the patient and tell him prompt treatment is required to avoid serious illness. Drugs to reduce hormonal effect, if required, surgery, radiation to remove the non-cancerous cells. So here the keyword would be prompt treatment, avoid serious illness. So how we can create a sentence from it? So you can say, I know you're going through an emotionally upsetting situation, but I assure you that with appropriate treatment, we can avoid the seriousness of your illness. Please make sure that you take the medication at the right time because we can reduce the hormonal effect from it. And if required, with the doctor's advice, we can even consider surgery or radiation to remove the non-cancerous cells. So that is how you go with the sentence there. The last task, advise the patient to see the doctor and offer a leaflet. Keywords, see the doctor, leaflet. So you can say, I strongly recommend you to wait to see the doctor. And for more information, I would hand over a patient information leaflet where you can find more information about this condition and how to tackle it. So that's how you create sentences from the keywords for this particular cue card. And for more reference, please watch the video where the roleplay has been done by Tina Miss about how to tackle the situation. And for more such videos, stay tuned to IILT's YouTube channel, and I'll see you next time. Take care.
IILT, it's my cup of tea.